Good morning. My name is Bill Jones. I'm the president of a company called the National Alliance of Insurance Agencies. And with me this morning, I have the privilege to talk with Barry Glenn, who's the president of Triada and the creator of their very innovative product, GAP Plus. And we're recording this video because as I've come to fully understand the GAP Plus product and concept, and our organization is bringing it out to several others across the country, we get a number of common questions. So I asked Barry to do this interview so that we could ask those questions and record his answers, introduce him, and hopefully make an efficient way to help people feel comfortable with what he's doing, which I think is very innovative, and hopefully get people comfortable with Triada, Barry, the GAP Plus concept, and decide to embrace this new product. So thank you, Barry, for taking the time to do this. So let's start with who you are and a little bit of your background, if we could do that.
Yeah, absolutely, Bill. So again, my name is Barry Glenn. I'm the president and CEO of Triada, the founder of the company, and I have spent the last 30 years of my career in the employee benefit space. We started primarily on the broker side, so we were the people who shopped the major medical plans for small to mid-sized companies, recommended benefit solutions, plan design, structures, and really started moving over to the product development side about 12 years ago. And have built several products inside the health and accident space. Most recently, the product we're discussing today, which is the Triada GAP Plus product. We developed this product very specifically based on needs we saw emerging in the marketplace under healthcare reform. And that's really where we land today, is how we solve those key issues that we identify.
So when did that development work start?
We really started, Bill, in 2009. And as we looked at the Affordable Care Act and looked at some of the changes in legislation and what the potential impact was on not just how health insurance was delivered, but the cost of health insurance and some specific benefits they were trying to create for the American consumer, which several of those were really good changes, but they led to increased utilization and increased risk on health plans. And so I think what we anticipated and what everybody has seen is bring more risk onto insurance, you're going to increase cost. And so we've seen those rates go up over the last 10 years, about 72%. And so I think that's kind of what's created the stress in the marketplace that our product kind of helps alleviate a lot of that stress.
Okay, so 2009, that's 11 years ago, almost 12. So you've been at this a while. And let's describe how the product works. Walk all of us through the GAP Plus contract structure, if you could.
Yeah, absolutely. So when we started the design of the GAP Plus product, and we worked in collaboration with the ERISA team at Haynes Boone on the structure and design of the product. And what we looked at, we took traditional plans that had been in the marketplace for a number of years, like cancer plans or critical illness plans, that had a core insurance foundation of specific benefits, whether they were indemnity-based or whether they were reimbursement-based, that also included a screening, diagnostic, wellness component to the policy. And then we looked at how we expanded on that strategy. And what we saw the two key needs being, number one, as we saw the cost of health insurance go up, we knew companies were going to have to start to look at plan designs. And one of the easiest ways to reduce rates is increased deductibles. It had been happening over a number of years prior to 2010, but when you saw those exponential increases in premiums starting in 2010, it became almost necessary for companies to take that approach. So we knew the right foundational product was gap insurance. And so very simply, the insurance component of our product is traditional gap insurance. So it's designed to cover deductible, co-insurance, inpatient, outpatient benefits, and function to help relieve some of that financial stress that employees are feeling with increasing deductibles and that first dollar exposure. And then the secondary component of the plan was designed to really accomplish what people have been trying to accomplish inside of wellness for years now. And that's How do we get people engaged earlier, do more preventative, do more diagnostic, provide access to qualified health professionals to start to manage risk before developing risk becomes chronic or a catastrophic occurrence?
So that's, yeah, the second piece that you're talking about, that's the plus.
Exactly.
So that's, so it's basic gap plus is basic gap insurance that covers the deductibles and copays, most of them. And then the plus piece is a wellness piece that has a lot of other additional benefits to help employee improve the health of employees. But it's all put together in a way that doesn't cost the employee anything on a net basis. They do pay a premium, but because it goes through Section 125, can you kind of walk through that? Because that's the part that, people twist their head a little bit and they think, well, this sounds too good to be true, that they're going to get their deductibles and copays covered without really any or very little out-of-pocket cost on a net basis.
Yeah, absolutely. And so Bill, people have been selling voluntary benefits for years with this strategy of, this is a Section 125 benefit. It's a health and accident plan. So even though the premium may be $10 a month, because it's coming out on a pre-tax basis, it's only going to reduce your pay by $7.50. So you have some tax arbitrage there due to Section 125. Well, the other piece is, though, when you look at something like a screening benefit, if you're having a benefit that is paid to you for medical treatment administered by a licensed healthcare professional, and as long as it follows traditional reimbursement rates, there's nothing excessive or abusive about it, then those claim payments to the individual for the medical treatment are not taxable to them. So you have the ability to essentially, and it was really interesting for us when we were meeting with several actuaries, looking specifically at cancer plan design. That's kind of the methodology they talked about is we build this benefit into the rate and we look at it as a dollar in, dollar out benefit. We want every person to take advantage of the screening portion. But what we're able to accomplish through that is we're able to create a certain amount of tax arbitrage that helps free up some savings for the individual. The final piece that we really haven't talked about much yet is the actual health risk management portion, or the wellness program, you might say. And that's really what creates the utilization, and it creates the ease of access and the participation for the members. So by being able to, number one, provide a direct monetary benefit to the individual for getting engaged in healthcare and managing their health and giving us the information to help work with them, we had to create a program that would deliver those services to the member in a very simplistic, easy to use way. So we knew if we went in and said, everybody's got to get blood from day one, we're going to lose people right off the bat. What we were looking at was, how do I create a program that is user friendly? It has to gather meaningful data for us to be able to manage the risk. But how can I create a very simple point of entry for people to start to get engaged in a very simple, non-invasive way and begin to grow that database on that individual over time? And so if I can financially incentivize that person through claim payments to do the right things and to have the right behaviors, and then I could provide a program that's easy to use, what we have found is we can get tremendous levels of participation in the program. Often close to 80% of the population will engage in the program.
Wow. Well, yeah, 80% participation on technically a voluntary product is very, very high. But I want to come back to the, to make sure that I understand and people understand the structure of this. And essentially, there's the two pieces. There's the gap insurance product, and then there's the wellness piece, which is the plus piece. But all of that is inside a qualified insurance policy, correct?
Correct.
So it's all insurance. And I know that there have been companies in the past that have tried to do something similar to what you're doing, but they haven't structured it all inside an insurance policy. So it really hasn't been compliant. But you're different because the entire program is insurance, correct?
Absolutely.
Okay. And and I'll make this final point on wellness. Some company, wellness has been something that's been focused on by a lot of brokers and employers for a while, and several of brokers and employers offer wellness programs. What do you do with the Gap Plus plan with employers that already offer wellness? Can they coexist or work together?
Absolutely, Bill. You know, the goal of our program is not to displace what you're doing today. I mean, there are a lot of great wellness programs out there. And, you know, the challenge that most wellness programs have is, you know, if I go into the average population in America, I've got about half the employees actively engaged in healthcare and the other half that just aren't. Some of those are healthy, but we also know there's some developing risks there. If I come in with a traditional wellness program, all studies have shown if a person is not inclined to go to the doctor and get engaged in annual wellness checks, they won't join the wellness program. And that's why you see participation rates somewhere around 30%. But there are great components. So if we can take momentum that's already been built inside of an existing initiative and start to put some more impact behind that by getting greater engagement in their population, using some of the components that they have to drive incentives and to drive participation, it becomes a great collaborative effort. So they don't have to displace that. Ours is very turnkey and very comprehensive. So depending on how much money they're spending on that initiative and how much benefit they're really seeing, the company can then make the choice, but we can absolutely engage with that. Just like we're not trying to replace anybody's primary care physician. We're just providing access to licensed healthcare professionals for that half the population that aren't going to the doctor. So we're not here to displace major medical plans, to displace any type of current care, chronic disease management, nothing else the company has going on. We're here to supplement and help and drive engagement in those programs.
Okay, yeah, and on the and you know, as far as the you know, what makes this very attractive to the employees that participate in Gap Plus is that it doesn't cost them a lot of money or any money to get their deductibles and copays covered. What is the requirement for the employee? How hard is it for them to meet the requirements in order to get that claim payment, that insurance claim payment back the same time they get paid?
Yeah, absolutely. So inside the plus portion of the policy, you'll see two components. There's a screening and diagnostic benefit, and there's a treatment benefit. So under the screening and diagnostic piece, there are a couple things the employee has to do. Number one, during open enrollment, we do biometric screening processes. And I mentioned we have several non-invasive, you know, things from body composition scans that take 15 seconds. We have different kits that operate off cheek swab, and we'll also do full blood panels and full blood work on people, just depending on what the tolerance level of the individual is. So they have to complete that biometric screening portion during the open enrollment. In the first month, the member is going to be contacted by their coach, who they will have met during the open enrollment doing the screening, and they're going to send them a link to an online health risk assessment. So they'll have to do that. So in the first 60 days, really, we've got biometric screenings, health risk assessments. You're already engaged with your health coach, and that kind of meets that diagnostic screening component. We are also taking all of the claims data from the health plan. So we have this evolving risk model that we're developing on every individual every single month. It gets updated in real time. What the employee has to do during open enrollment is sign that HIPAA release so we have access to all that information. So we'll continue to run the diagnostic process all year long. On the treatment side, it's your engagement with your health coach. Every member is assigned a health coach. We maximize the employee count at 500 for our coaches. So it's a very personal relationship. And the coach is actually making the outbound contact to the individual. So it's not like, oh, I forgot. All I have to do really is respond to my coach. And I even get to choose how I want the coach to communicate with me. So it can be through Skype, it can be through traditional calls, it can be through chat functionality we have in our application. It can be text messaging, email. The employee gets to choose. And that coach is going to touch them twice a month. For the average person, it's going to take 20 to 25 minutes a month of your time to meet the compliance piece with your health coach. The other side of that, though, is members do have unlimited access. And when you look inside of our HRM program, we have telemedicine, we have advocacy, we have all kinds of services, EAP services. Employees and their covered family members all have access to all the services on an unlimited basis, and there's no cost to them. And so the minimum barrier point is those two touches from your coach, but it's really up to the individual what they feel like they need from our program.
So I think the takeaway on this is that it's not a heavy lift for the employees to meet the requirement to justify the medical claim payment that comes back to them through the HRM portion or the plus portion of the program that ends up making it after tax savings really no net cost to them. Did I say that correctly?
Yeah, absolutely.
Okay.
Absolutely.
Now, let me come back to the contract structure for a minute. Now, this, you partner with Swiss Re, correct?
Correct. Correct.
So Swiss Re, most people know, I mean, they're the largest reinsurer in the world, huge company. Walk us through what they do for you, what your relationship is with them. And I don't think I mentioned in the beginning, but I think we need to mention is this insurance product, Gap Plus, is a self-funded design, correct? So
Correct.
walk us through that a little bit and the role that Swiss Re plays with you in this.
Yeah, absolutely. So the Swiss Re role really is underwriting the entire program. So Swiss Re is taking all risk essentially for the claims process. So part of that process is just like any other insurance product, we go through the actuarial evaluation to look at what are the specific benefits of the plan, what are the age demographics that we need to break out, and what is the anticipated claims utilization on that population. And so once you set that number, our contract with Swiss Re says, okay, here's our anticipated claims fund. We now will put what they call a 25% corridor on that, meaning we will take the full claims fund and an additional 25% of that number. So let's just say you anticipate claims at 50%. That would mean you would actually put 62.5%, that 25% corridor, into the claims fund. And that's what our reserves are. That goes into a premium trust account that is a joint trust account between Triata and Swiss Re. And that is the fund that we pay all of the claims out of. And then Swiss Re then, through our stop loss agreement, attaches at that 62.5% threshold. So if any individual group's claims exceed the 62.5%, Swiss Re steps in out of the stop loss arrangement and pays any additional claims or any excess claims. So there truly is no risk to the employer, to the employee, no financial exposure. It's all covered in the design and the funding of the plan.
So, all right, let me see if I can, I've been in the insurance world a long time and I understand this, but I want to bring it down a little bit into maybe more common terms. You're basically assuming, just to use your number of 50%, you're assuming that 50 cents on a dollar that comes in premium is going to go out in claims. But Swiss Re has a policy that, if we're off, we want to be more conservative in our reserving. We want to reserve 25% more than what we think is going to happen, is what I think I'm hearing you say, correct? How are the claims running now?
So our claims are running slightly below expectations. So the plan is actually performing very well. I think one of the things that we have seen, and that I think Swiss Re has seen through our program, is because of the high level of adoption, we kind of really avoid what is the most common problem in supplemental benefits in the United States, which is adverse selection. When people come and buy a voluntary product, it's typically because they have this perceived need. I have a family history of cancer, or I maxed out my deductible last year, so I'm going to buy a benefit to help cover that. Well, if I have the ability to go in and through our financial incentives in the plan, bring people into the program that might not normally elect because they're relatively healthy, it gives us a much better risk pool. So the benefit we have is with 80% participation, you've got a kind of the ideal scenario for insurance, a broad spread of risk, and the plans just perform better than expected.
Okay. All right. So this structure, most of my career and, most of the people that I have worked with over the years are used to dealing with insurance products that are filed on a state by state basis. They go through the individual state departments and get approved or not approved and so on. But this one's structured differently. Who regulates this?
So for self-funded plans, I mean, any self-funded health plan is regulated by the Department of Labor under ERISA. And so that's the oversight. So what they look at is structure of plan design, cost of the benefits, the benefit payment amounts to make sure everything falls in line. So You know, when you look at the plus portion, for example, people go, well, how can you reimburse $400 for an individual? Well, we look at the CPT codes relative to the services provided by our licensed health coaches, and we use CMS reimbursement rates, so very conservative reimbursement rates. So when the DOL looks at the plan design, they say reimbursement rates are within acceptable limits. The plan design, the rates for the overall plan design meet expectations. Your minimum loss ratio requirements are there. So that's really who oversees any type of a self-funded health plan.
So you do have to get approval from this. It's just from a federal agency, not individual state by states, correct?
Correct.
All right.
Correct.
So, I have received, because this is such a new and innovative concept, and people question the tax aspect of it and the legality of it. I've had the question a couple times, have you gone to the Internal Revenue Service and sought a private letter ruling on the structure of this? And I think the answer is no. So tell me why we don't need that.
Well, what we looked at, Bill, was just what is the precedence in this space? And so I don't know that there's anyone out there that would question, is a premium for a health and accident plan eligible for pre-tax treatment under Section 125, which is, Section 125 was written in the mid-1950s. Companies started taking pre-tax deductions in the mid-1970s. So it's been around a long time. And I made that analogy to things like cancer plans and critical illness plans. So cancer plans have been pre-taxed for years, and they're indemnity-based benefits. They include the screening benefits. They pay those benefits to the member, and it's never come under question about, if you're going to pay me for annual cancer screening, is this relative to my cost, as long as that reimbursement amount is reasonable. I couldn't say, do your annual cancer screening and I'll give you $10,000. I have to look at the cost of the process and give you reasonable reimbursement rates for the services. And so as long as my benefit levels are in line, and that's part of that audit process on your plan, as long as those follow reasonable reimbursement rates, which CMS is a very conservative reimbursement rate, then you're not providing excess reimbursements. I think where so many of these plans have created issues is, number one, most of them lack a true insurance component. So they're not even eligible for pre-tax treatment. But the other piece is there's really no function inside the program. There's really no true population health management. It just becomes a way to push dollars through payroll. It's very important to understand that our structure is a pre-tax premium taken by the employer through payroll, and then we as an insurance company evaluate specific occurrences and will pay claim payments directly to the member based on completion of those specific occurrences or activities.
And those claim payments are in line with Medicare guidelines, which are conservative, and they are audited by Swiss Re, correct?
Absolutely.
And you have to pass muster with the Department of Labor, who has oversight of this program.
Absolutely.
Did I summarize that correctly?
That's correct.
Okay. So let me go. So you started the development of this 11 years ago, or almost 12. But you really only took it to market in the past couple years. I mean, it took a long time to get this baby born, so to speak. So talk to me about how, what's going on in the marketplace, who's adopting it. Is there a particular type of industry or company that this fits or doesn't fit? Kind of walk me through what's been happening the past couple of years as you've brought this product to market.
Yeah, absolutely. So our first product, Bill, was filed in 2014, and it was built. The original product was built on a hospital indemnity chassis, and that was what the underlying carrier that we were partnered with at the time had. And so the product took off. We got great reception in the marketplace. We had two limitations with the initial carrier. The first was they were a B+ carrier. So most large brokerage firms, large employers won't ride with a B+ carrier. And then their footprint was only 24 states. But it gave us the ability to, number one, build technology and test the concept. We always felt the right underlying product based on what was going on inside of healthcare was GAAP. because it's a much more understandable product for the consumer. It coordinates with your major medical plan. So it's a very seamless integration. And so that process, we started the build of that product in 2016, and we brought it to market in 2018. And so what we've seen since that time, obviously we're well into healthcare reform. There's been a lot of movement inside of that legislation with the elimination of the individual mandates and some of those types of things. Now we see states bringing individual mandates back. And so what we're seeing is, especially with potential changes in administration, you're going to start to see healthcare reform take another transition. And I don't know that anybody's really sure exactly where that's going. But what we're seeing in all companies across the board, and we're working with small groups, large groups, labor unions. We have clients across all industries, from landscaping companies to engineering to law firms to CPA firms. And what we see is every company struggling with the cost of healthcare, without exception. And so the two key things are, how can we help people with plan design and help them with, maybe I need to raise deductibles, but how do I retain employees? How do I recruit talent if my benefits are perceived as not being competitive? Well, this kind of changes that whole dynamic for the company. But the other thing, when you look at other industries like, landscaping, hospitality, those types of industries that are typically very difficult to fund benefits for, we've been able with Swiss Re to bring in things like minimum essential coverage plans and minimum value plans to help employers that are over that 50 employee threshold build very economical plan designs in a very seamless way, and using our underlying product to help with the funding mechanism as well.
Okay. By the way, one thing I forgot to mention in the beginning is what today's date is. Today, I thought, because these videos stay around for a while. Anyway, today is December 18th, 2020. So we're approaching the end of the year. So it took you a couple of years working with Swiss Re to get this design down, to migrate to the GAP, underlying GAP insurance product, and create an insured product that is on a self-funded design. And you've been rolling it out for a couple of years. Prior to that, you had the ability to build some technology. So talk me through, and talk others through, how's it going? Are you growing? Are you having issues? Do you have a capacity problem? This is a very popular product. I think I believe is going to take off in the marketplace rather quickly. Can you handle that?
You brought up a good point when you were talking about the technology aspect. So obviously, one of the biggest challenges you have with any benefit in the country, and supplemental benefits included, is how do I get people enrolled? Because the old traditional model in supplemental benefits is on-site enrollments, face-to-face, one-on-one, sitting across the table. Well, number one, in this current environment, and you said the date, we all know we're in the midst of COVID. So people don't want people coming out on site and sitting face-to-face with their employees, or even mask to mask in most situations. So having the ability to use technology, we built a very innovative tool inside of our technology. So we have built it to basically present the program. It asks the members some specific questions that might help identify what their specific needs are, match the GAP, underlying GAP design to their current health plan, and then make a package recommendation. So we use technology to function like an enroller. So you get several advantages when you do that. Number one, unlimited scalability. It's housed in Microsoft Azure, which is one of the two largest cloud-based environments in the world, fully HIPAA compliant. And so it gives us the ability really to grow with no limitations from the technology perspective. But it also allows us to make sure a consistent message is delivered. I think most of us in this space that have been around for a while have seen good enrollers and bad enrollers. You've seen people that misinform clients. You've seen people that do a great job of really being a great consultant. And the thing about technology is it delivers the same message every time, and it's documented, and we're sure that all of our information is accurate. But the other thing it allows you to do is give that employee some flexibility. I can enroll with my spouse, or I can do it from home, or on a break, or whatever the case may be. So we think that piece was critical. And we actually built that long before COVID ever hit, because we knew to be able to scale, we had to be able to use technology to do that. So that was a key point. The other piece is, and I think you really hit this when you introduced Swiss Re, is capacity. So how long can you continue to take on new risks? Well, that It's determined by the financial resources of who is underwriting the program. And so, when you take a company like Swiss Re, we're signing another contract right now with one of the other largest reinsurance companies in the world. And so capacity is not going to be an issue. We're going to have the ability to grow as fast and as furious. What we have seen, Bill, over the last couple of years is we're now over 800 client companies. We're over 500,000 lives. Based on the contracts we have signed over the next 90 days, we'll be close to 1 million lives. So the product is taking off. We're having a lot of success, and we just continue to grow our staff to support that. Just like any company, as you have exponential growth, you'll have growing pains, and there are sometimes delays. But the thing we always focus on, it can never impact the consumer. So when we deliver the product and a member has a claim or a member has an issue, those are places that we can't sacrifice service. So our first and most highly prioritized hiring is claims and customer service. So people will log in, they can chat online, they can call us. When they file their claim, we process every claim in the first 24 hours. So delivering what the client needs is point number one. All of the other aspects we're continuing to grow in a grassroots sort of way.
Yeah, well, I can tell you that the groups that I've brought Gap Plus to that have enrolled, they have not experienced any issues with claims being paid. So I will just echo what you're saying there, and at least we haven't experienced that. So you do have some groups that have been around a couple of years, right? Mm-hmm. What's the renewal rate? Do people drop this after a year? Do employees renew? Do employers drop it? What's going on with renewals?
Well, tell you, Bill, we have lost 2 groups in our history, and one group was sold and the other group went out of business. And so we just typically don't lose groups. Once the group is set up in the system, and one of the biggest concerns you have typically with supplemental benefits is either my employees are having a bad experience, and so we're just not going to do this anymore. It's not good for my employees, or it's an administrative nightmare. Billing is an issue, getting claims paid is an issue. And so, part of that, using technology to streamline those processes and automate all those processes, self-build, it's a very clean process. So we just don't lose clients. But even inside the employee base, what we see, one of the biggest objections we always get is, that sounds too good to be true. There's got to be a catch. And so people are going to kind of go, well, I'm going to sit back and let me let everybody else sign up and I'll see how this works. Well, what always happens is the program works as advertised. It works for people. It benefits people. So we see participation in every single group go up year over year. And so even if a group starts in the 50 to 70% range, we see that move up to over 80% within the first 2 years.
Okay, I appreciate. Thank you. And something else just hit me that I think I want to ask you about, and that is part of the goal of this program is not only cover the deductibles and copays for the employees, but it's really, and I know from talking with you, is to improve the health of the employee. To help them be healthier, live better lives, and for the employer to improve the medical claims experience on their underlying major medical program. Can you talk to this a little bit? And do you have data and experience that you've been able to collect to help employers reduce their underlying major medical costs? Can we talk?
Absolutely, Bill. So we did take 3 companies that are kind of in the 1,000 to 2,000 employee range that have been with us for at least 3 years. And of course, we get the claims data. So we have historical claims data when we start. We know where they're trending. We've been able to track their progress through our program and kind of seen. And really what you start to see, we're driving more people into preventative care. So in the first couple of years, it's relatively flat. But what you start to see, and what we've seen in all 3 companies that we did our white paper on, all 3 of those companies saw between a 9 and 12% reduction by year 3. And so the ability to truly go in, and obviously there's a lot of varying factors when you look at utilization in a specific target group. But the other thing that we do is we do biometrics every single year. So when we go out and do Bill Jones this year, we're going to come back a year from now and do Bill Jones again. And we're going to look at, where did Bill move the needle? Is he showing better either blood work results, or is he have a better BMI and do his overall physical risk factors look better? And so, nothing we do is outcomes based, meaning you're not penalized if you weren't able to get the results that we were hoping you would get. Everything is activity based. But what we've seen historically is if I can keep Bill Jones engaged, I'm going to see a progressive movement reduction. And we have tons of employee testimonials about losing 53 pounds. I'm off my diabetes medication, and just those types of stories. I think one of the things that we've really seen, Bill, is that I think a lot of us in the health insurance space kind of felt like, well, you got a group of people who will take responsibility for their health, and you have this other group of people that are just apathetic. They don't care. Doesn't matter what you do, they're not going to get engaged and they're not going to change. And there may be a few of those people, but I think the real barrier is understanding how. You can go to the doctor and he can tell you lose 50 pounds to stop eating fried food. Okay, now how do I lose 50 pounds? And so having someone who is highly educated that will take you where you are today and just take you simple step by simple step on ways to slowly change lifestyle, slowly change behaviors that over the long term are going to have a dramatic impact on your overall health. That's really what people need, and people respond to that.
Yeah. Okay. Thank you. And just speaking of the coaches for a second, what are their credentials?
So all coaches are medically licensed. So they have specific disciplines. We have everything from dietitians, nutritionists, physical therapists, nurses, nurse practitioners. We have doctors on staff. We have a cardiologist on staff. So it really is a suite of resources. We include counseling services and those types of things as well. So, but the important thing is, a lot of people, if you try to just classify this as wellness, you're really underselling it because it is healthcare and health risk management. It's licensed nurses, licensed doctors, licensed practitioners that are working with the members with sound medical advice to improve their risk. And so those are the credentials that are required.
Yeah, and just a comment for me, most wellness programs that I've seen are passive or reactive on the part of the employee, and because of the requirement to fulfill, to receive that medical claim benefit through the health risk management portion of the contract or the plus portion of the contract, there is proactivity required on the employee's part. They have to engage, which essentially generates that medical claim through what is, I guess you would say technically a virtual medical visit. Is that correct?
Absolutely. I mean, you look at it now, Bill, you're seeing most people are visiting their doctor through Skype or a HIPAA compliant video conference. And so we've now seen that it's pretty effective, and it's a lot easier to do that than to drive to the doctor's office and sit in the waiting room. So it really is ease of access is a huge part of it. And so I think that people have seen that number one, they kind of get bogged down in the mechanics of the plan. How do these mechanics all work? The mechanics are a way to drive a behavior. If I can financially incentivize people to get engaged and I can provide easy access to resources, I can get people engaged. And that's really what the purpose of the program is. It's not how do we save some taxes and how do we do that? The purpose of the program is how do we move people from inactivity to engagement? That's the whole goal.
Okay. So I don't think I have any other pertinent questions. I just maybe make a summary statement that you can affirm, hopefully. And that is GAP Plus is a self-funded insurance product design that is fully supported by Swiss Re, regulated through the Department of Labor. It is ACA compliant, ERISA compliant, and Section 125 qualified. Did I get all that right?
Absolutely.
Okay. Yeah. So, and the key difference from plans that some are still out there and some that have come before with this quote wellness piece is, they haven't been insured plans and they really haven't been set up in a compliant manner. So Triada has created an insurance product that does have this quote wellness piece to it, that does comply with insurance regulations and federal law.
You hit it right on hit the nail right on the head.
Did I say that right?
Yeah.
I guess I've learned. So just in closing here, is there anything else you want to add? I think I've covered most of the questions or confusion that we hear from people. So anything else, anything you'd like to add?
No, I think you've done a great job, Bill. I mean, I think the thing that I would encourage anyone that is looking at, how do we go into our clients and create a differentiator? So we have to look at innovative strategies. If we continue to do the same things, we're going to continue to get the same results. But if we look outside the box, obviously we don't want to take risks. We don't want to put our clients in harm's way. But what we want to look at is, how do we change the landscape? How do we change the utilization habits of the American consumer? And the only way we're going to do that is engaging them at a one-on-one level and starting to change each individual one at a time. And if we can do that, there's a short-term goal of alleviating the financial strain of deductibles and coinsurance and significant financial exposure. But the long-term goal is, as you drive down utilization, you drive down cost. And as we can do that, companies are going to become more profitable. We can take those dollars and focus them elsewhere. Employees will have happier, healthier, more productive lives. Those are the right answers. I think everybody in the space is trying to do the right thing. It's just, how do we find the right way to reach the consumer and get them moved into action? And that's our purpose, and that's our goal.
Okay. Well, Barry, I think we can wrap this up. Thank you. It's good to see you again. Thank you for taking the time on December 18th, 2020 to record this with me. And we'll be sending this out to a number of people, and we'll see if other questions come up or we have other reasons to do a video, we will. So
thanks much, Bill.
Hope you have a great holiday, and thanks again for the time today.
Absolutely. You as well. Thanks, Bill.